Welcome to this month's Veritiv training on incident and hazard reporting. Today's agenda, we will discuss types of incidents, reporting of incidents, nurse triage service, Origami, hazard or near-miss reporting, and stop work authority. Definitions, types of incidents. Work-related injury/illness. An injury or illness is work-related if an event or exposure in the work environment either caused or contributed to the resulting condition or significantly aggravated a pre-existing injury or illness. Non-work-related injury/illness. An injury or personal health condition that is not associated with the work environment. For example, heart attack, diabetes-related event, broke collarbone playing soccer over the weekend. Near-miss incident, a hazardous and undesirable event that does not cause injury but could have. First aid refers to medical attention that is usually administered immediately after the injury occurs and at the location where it occurred. It often consists of a one-time, short-term treatment and requires little technology or training to administer. SIF, significant injury or fatality, or PSIF, an incident that resulted in, or could have resulted in, a fatality or serious life-altering injury. SIFs can be actual, for example, injury occurred, or potential, for example, near miss. What is considered a first aid incident? Use of non-prescription medication, administering tetanus immunizations, cleaning, flushing, or soaking wounds on the surface of the skin, using wound coverings such as bandages, band-aids, gauze pads, etc., or using butterfly bandages or steri-strip. Hot or cold therapy, using any non-rigid means of support, such as elastic bandages, wraps, non-rigid back belts, etc. Using temporary immobilization devices while transporting an accident victim, for example, splints, slings, neck collar, backboards, etc. First report of incident form basic principles. Anytime a team member reports an incident, injury, or pain, as a supervisor or manager, you must take appropriate action. Failure to take action may result in disciplinary measures. Work-related injuries are covered by workers' compensation insurance. Team members who suffer work-related injuries must follow our process. Prompt reporting to manager/supervisor. Call nurse triage service with supervisor. Self-care, additional medical treatment. Completion of the first report of incident form and other forms if required. Treatment at an approved occupational health clinic. Return work activity status report from clinic back to HR and/or supervisor. Non-work-related injuries or personal medical conditions are covered by the team member's personal medical insurance and should be treated by the team member's personal health physician. Now let's review Veritiv's nurse triage service. Employees must report all work-related injuries, regardless of severity, to a manager or supervisor. For non-emergency injuries, employees must participate in the nurse triage call by his/her manager or supervisor. Employees may not refuse to speak to a nurse triage occupational nurse when injured. Nurse triage is for Veritiv employees only. May not be used for addressing temporary worker injuries. Note, all injuries, employee and temp worker, must be reported in Origami within 24 hours. Some frequently asked questions. Will they have enough nurses to answer our calls? Yes. The call center maintains an average response time of 15 seconds or less. While occasional short delays may occur, these are rare. How long will the call take? Each call is unique, but the average duration is approximately 20 minutes. Nurses are trained to assess all relevant information and provide clear guidance on next steps, self-care, or self-medication instructions. Who should talk to the nurse? The nurse must speak directly with the injured employee in a private setting. This allows for a thorough discussion, including personal medical history, current conditions, medications, allergies, and symptoms. Supervisors or managers may speak with the nurse after the initial employee-nurse conversation if further clarification is needed. What if the employee calls a day or two after their injury occurred? If the employee contacts the nurse a day or more after the injury, the nurse will document both the injury and call dates, along with any explanation provided for the delay in reporting. What if the employee is taken to a hospital or seeks treatment on their own? If the employee visits a hospital or seeks treatment without calling the nurse, the manager should follow the standard work reporting process. Can the employee call the nurse back if they have additional questions or symptoms? Yes. Nurses encourage employees to call back with any questions or changes in symptoms. Follow-up calls may also be initiated by the nurse if appropriate. During the initial call, the nurse will request permission to follow up and collect contact information. For self-care cases with expected changes, a follow-up call will be attempted. Nurse triage service continued. When self-treatment is recommended, if self-treatment is appropriate, the triage nurse will provide written instructions via email or fax to the employee through their manager. Both the employee and manager can call the nurse triage line as often as needed with questions about the injury. If the employee chooses to seek medical treatment, any future questions must be directed to Kim Lane, the workers' comp claims manager, at 770-391-8390 or kim.lane@veritiv.com. The nurse will never advise the employee to simply go home and rest. The nurse will either provide self-treatment instructions and direct the employee to continue working or refer them for professional medical care. Follow-ups may occur, but only with the employee's permission. When medical treatment is recommended. If medical treatment is necessary, the nurse will direct the employee to the designated clinics. Always confirm the clinic is the correct one for your location. If the employee is traveling, the nurse will locate a clinic nearby. Whenever possible, the supervisor-manager should accompany employee to clinic. The nurse will contact the clinic directly to notify them of the incoming employee, provide a brief on the employee's condition, ensure a drug screen is completed. A point of injury, POI report, will be sent to Kim Lane detailing the discussion. The incident must be reported in Origami via the risk management reporting page. All incidents must be reported promptly and no later than 24 hours after the injury. Drug and alcohol screening will be done if significant damage to property, an injury to the employee or others involved in the incident requiring treatment by a healthcare professional, exposure or potential exposure to a toxic or hazardous substance, or reasonable suspicion. Now let's discuss Veritiv's Incident Management System, Origami. Veritiv's Incident Management System. We'll be replacing She Assure. We'll be able to get to Origami from Vibe, link provided on this slide. Manager, supervisor to enter incident into Origami by end of shift, but no later than 24 hours. Types of incidents entered: worker, vehicle, property, facility, security, and general liability. Upload documents, first report of incident, witness statements, pics, etc. Work with EHS professional to gather information and complete investigation. Communicate, follow up with claims managers, Kim Lane or Jerry Brantley. Near miss and hazard reporting. What is a near miss? A near miss is an unplanned event that did not result in injury, illness, or damage, but had the potential to do so. Only a fortunate break in the chain of events prevented an injury or fatality or damage from occurring. Anyone who witnesses such an event is in an ideal position to describe what they observed firsthand and what factors prevented the loss from occurring. By reporting these details, we can do something to prevent a reoccurrence, because next time it happens, it may not be a near miss. Every near miss that is reported is a great opportunity for us to learn and will make a vital contribution to the ongoing development of our safety programs. The near miss process. What should a coworker who witnesses a near miss or hazardous situation do? Make sure the situation is safe and inform your supervisor or manager immediately. Together, you will investigate the problem. Take immediate corrective action, if not possible. Agree to a reasonable timeline to complete the fix. Fill out a near-miss card explaining what happened, what's been done, or when it will be done. Submit the near-miss card to your supervisor or manager. Making it work. Many coworkers misunderstand what is meant by a near miss, and as a result, they underreport them. Take your team on a tour of the site and point out the hazardous situations you see. Ask individual coworkers to report what you find and explain to them how they will be contributing to the safety of the site. Give examples of what constitutes a near miss at your team meetings. It is important that your team understands that a near miss is a positive intervention. It is about fact-finding and not fault-finding. Any changes that are suggested as a result will be of a constructive nature and will help make the location an even safer place to work. Anyone working on or visiting an OPS facility is encouraged to submit a near-miss report when they are involved in witnessing or are told of a near-miss event. Even an event that was experienced in the past should be reported, as the learning could still be current. Anyone inexperienced or new to the location should also be encouraged to speak up and report anything they believe to be unsafe. Fresh eyes can often see more clearly. How to report a near miss? Report near misses by completing a near miss card. Turn in near miss card to supervisor or put in near miss station at various location and facility. Choose a high traffic area to be as visible to all coworkers as possible. Forms are available on OPS EHS SharePoint. Feedback. Explain to your coworkers that you are happy to discuss any safety situation with them openly. The Near Miss Board is a transparent and non-judgmental reporting program designed to encourage a proactive and supportive safety culture. However, if for any reason a coworker wishes to talk privately about a situation, you should accommodate this and arrange for a private discussion. Ensure that you respond to and investigate a near miss with the coworker who reported it before the end of their workday in which it was reported. Thank them for their input and discuss and explain what you have done or have planned to do about the situation. Never ignore a near miss, however minor. Even if you decide no action is necessary, discuss this and explain your decision. Stop work authority. All team members not only have the authority to stop work when control of a health, safety, or environmental hazard or risk is not clearly established or understood, they have an obligation to stop work. If you can't do it safely, it's not work doing. When to initiate stop work authority. You have stop work authority and are expected to use it whenever you see something you believe to be unsafe. You are responsible for your own safety. You should never do anything you believe to be unsafe. You have a responsibility to your fellow team members' safety, and you should never let them do anything unsafe. You are responsible for reporting all safety incidents to your supervisor, including injuries or accidents you are involved in. You're expected to report all safety concerns to your supervisor, safety captain, or safety committee. If necessary, elevate the concerns through any other available avenues with the company. Stop work authority form. When a team member identifies a perceived unsafe situation, condition, or act, they should complete the stop work authority form and forward to their immediate supervisor. Once the supervisor and/or manager has reviewed the situation, they should provide a brief narrative on the corrective actions taken and/or if they have issued a work stoppage. Once the form is completed, forward to your regional safety manager along with any pictures of the noted incident or event. Forms are available on OPS EHS SharePoint. Safety signage. To reinforce a strong safety culture, clearly posted signage is essential in reminding all employees and contractors of their right and responsibility to exercise stop work authority. Effective stop work authority signage should be visible and accessible in high traffic and high risk areas, simple and direct using clear language and bold visuals. Consistent with company policy, reflecting key messages like, if it's not safe, stop the work. Inclusive and empowering, encouraging all levels of staff to take action without fear of retaliation. Here are some good examples. Thank you for your participation on this Veritiv monthly training on incident and hazard reporting. If you have any questions, please reach out to your regional safety manager, as they will be glad to answer any questions you might have. Thank you, and have a safe and productive day.